Hi everyone, welcome back. Today we are going to study about hypothyroidism. So before we move with hypothyroidism, it is important to know a little about the thyroid gland. So I hope we all know this already, but giving it a small quick revision. Thyroid gland is an endocrine gland which is situated in the neck region. It has got two lobules and these two lobules are connected by isthmus, right? This is one lobule and this is the first lobule and this is another one and this is the isthmus. Okay. Moving ahead, the thyroid gland secretes T3, T4 and calcitonin hormones. So this is the basic of the thyroid gland. We will not go deep into the nerve supply and the venous supply. Moving to the feedback mechanism. Now, what is the feedback mechanism? The feedback mechanism is exactly telling you how this T3 and T4 is exactly secreted. So what happens is the hypothalamus is going to release TRH. This TRH is the thyroid regulating hormone. Now this TRH goes to the pituitary, to the anterior pituitary, and leads to the secretion of the TSH, which is the thyroid stimulating hormone. This TSH is going to stimulate the thyroid gland, which will release the T3 form, which is the inactive form. Okay, this is the inactive form, that is the T4. And now this T4 will get converted into the T3 form, which is the active form that is found in our body, and that is going to be supplied to the peripheral tissues. So this is the feedback mechanism, or you can say the mechanism which leads to the production of the T3 hormone. Fine. Now we have two things here: positive feedback mechanism and the negative feedback mechanism. Discussing the first about the positive feedback mechanism. Now what do you mean by the positive feedback mechanism is whenever the level of the T3 and T4 in the body is decreased. Okay, concentrate on everything which I am saying. Whenever the level of the T3 and the T4 hormone in the body decreases, eventually what will happen? Whenever this level is going to decrease, this level is going to send message to the pituitary that there is a decrease in the level of T3 and T4 in the body, and immediately more of the TSH is going to be secreted. Now when more TSH is secreted by the pituitary, more T3 and T4 hormone will be secreted and the level will be balanced. So initially the level was decreasing, but later when the message was sent to the pituitary, it leads to the secretion of more TSH, which increased the secretion of T3 and T4. So we were actually decreasing initially, and later after increased in the TSH production, the level of T3 and T4 also increased. So this is something positive. Earlier it was negative, but afterwards it was increased. This is a positive feedback mechanism. Coming to a negative feedback mechanism. Okay, so negative feedback mechanism means that initially the level of T3 and T4 in the body was very high. What do you mean by the negative feedback mechanism? Here what is going to happen is that the level of the T3 and T4 is very much high in the body, and now this increased level is supposed to be decreased. So we are going in a negative direction. So this is a negative feedback mechanism. Now how will this happen? The procedure is very much similar. What is going to happen is, here now I am saying that the level of the T3 and T4 in the body is very much high. Now the message will go to the pituitary, and the pituitary will send the command to the TSH so that the secretion of the TSH will be decreased. Now as soon the secretion of the TSH is decreased, the T3 and the T4 secretion is also decreased in the body. So this is the positive feedback mechanism and the negative feedback mechanism. Now one thing you have to keep in mind here is that whenever we talk about the negative and the positive feedback mechanism, there are two conditions that are being created. These two conditions that are being created are going to be for your positive feedback and for your negative feedback. For your positive feedback, it is always going to be, now imagine I said you in the positive feedback that the level is initially decreased, okay, but later on it is kind of the level of the T3 and T4 is kind of balanced. Okay, so this is going to be a hypothyroidism condition. The level was decreasing, whereas in the negative condition the T3 T4 level was increased, and so this is the hyperthyroidism. These are the two thyroid conditions that can be seen. So this was about the feedback mechanism. Coming to the first one, the hypothyroidism. We'll give a very quick revision to this topic. Hypothyroidism, as I told you in the name itself, the level of thyroid hormone, that is T3 and T4 here, is going to fall down. It is hypo. Hypo means decreased. Okay, the term hypo means decreased. So hypothyroidism is a condition in which the level of the T3 and the T4 hormone falls down. What are the reasons? Any autoimmune disorder, Hashimoto thyroiditis, iodine deficiency, use of any kind of drugs, transient thyroiditis. These are the 5 etiological factors which can lead to your hypothyroidism. Moving ahead to some clinical features, you have a number of clinical features here. One thing you have to keep in mind is, I'll give you a small trick to remember: weight gain. Now see here, hypothyroidism has got this O. Okay, now this is a funny trick. O here is going to denote a person who's really cute, obese you can say, but really round, and somebody who has gained a lot of weight. Okay, O here is for a obese patient, somebody who has gained a lot of weight. So by this you can remember that in hypothyroidism there will be weight gain which will be seen. Okay, so the first thing here is weight gain. Another thing, it is common in case of females. People who are a little obese or a little healthy, they are very cold intolerant. They cannot handle extremely cold temperatures. So you can just relate it to this like this. So weight gain is there, common in females. Cold intolerance is there, easy fatigue, dry skin, dry hair, constipation, menstrual disturbance, carpal tunnel syndrome, acne, muscle stiffness, pain in the muscles, depression, infertility, and sometimes hearing loss or deafness. Moving ahead to the signs, if you see the signs that will be seen in the patient is, there is hoarseness of the voice that can be seen, purplish lips can be there, mallow flush can be there, periorbital edema, that means swelling around the eyes, can be seen, loss of the lateral part of the eyebrows can be seen. Other than that, anemia, bradycardia, hypertension, these are some of the signs which can be seen in the patient suffering from hypothyroidism. Moving ahead to the investigation, what all investigations can be conducted to check if the patient is suffering from any kind of thyroid disorder or not? Firstly, check the TSH level. If the TSH level is increased, that means that the body has demanded for more TSH secretion. That means that the level of T3 and T4 is decreased in the body. So, in case of hypothyroidism, this TSH level is going to be increased. The T3 and the T4 level is going to be decreased. They are always inversely proportional to each other. If the TSH is high, that means that definitely the T3 and T4 was low in the body. So to balance it, the TSH has increased. Okay. Next thing, you will go to check the anemia condition, if the patient is anemic or not. CBC, that is the complete blood count, kidney profile, urine profile, to check if the patient is having diabetes, that is an autoimmune disorder or not. High cholesterol level, ECG will denote bradycardia, LDH level. Also, the alanine aminotransferase level is going to be increased in such patients. Okay, these are few investigations that can be conducted. Moving to the last part, that is the treatment. So the first thing you have to do is treatment with thyroxine. Okay, iodine deficiency is there. So keep this in mind that the iodine deficiency is fulfilled. That is commonly you get it from common salt. Okay, another thing is replacement of the thyroxine. So what do? We give thyroxine tablets to the patient. Now these thyroxine tablets which we give to the patient is given in a particular order. So for the initial 3 weeks you are going to give 50 mg per day. Then you will increase it for the next 3 weeks by 100 mg per day, and then a maintenance dose of about 100 to 150 mg per day is going to be conducted for the next 2 to 3 weeks. Okay. Now one thing to be kept in mind, this dosage is every time to be taken empty stomach in the morning. And for example, if you have taken the medicine, then for the next 45 minutes you do not have to eat anything. Okay, you will not eat anything for the next 45 minutes, and it is given to a person in an empty stomach in morning. Now you have to repeat the TSH test after 6 weeks to monitor that the TSH level has came back to normal or not. If it is normal, you can just stop the thyroxine tablet therapy, otherwise continue it further. Now the skin and the hair texture is going to be restored in the next 3 to 6 months. It will take time, but everything is going to be restored. The weight is going to be managed. Also, weight loss exercises are to be referred to the patient, that he has to exercise properly so that the weight is under control. Okay. Normal TSH level, that is the normal TSH range I should say, is 5.5 microunit per liter. So it should fall related to this unit only, this range only. Okay. One more thing you have to tell your patient is that, imagine when a person is getting obese, no matter because of what initial reason it is, for example it is hypothyroidism only, the patient has increased his weight. Now increased weight can lead to a lot of problems, like it can lead to diabetes, increased cholesterol. So that is the reason we conduct all these different tests in the patient, so that from all levels, from all angles, we are cleared that the patient is suffering from hypothyroidism. So this was about the treatment. I hope this topic is clear to you. The other part, that is hyperthyroidism, will be coming soon. Share this with your friends, like the video and subscribe to the channel. Thank you.